I give the task?
Yes, please.
So you have been asked to assess Mr. John Abraham, who is 18-year-old college student, brought to
Mhm.
emergency by police, referred as they
Yes.
felt that there is something wrong in his mental health. He has had to cut his wrist, stitch in casualty, assessed to look for evidence of psychosis, and arrive at a diagnosis.
Okay.
Let me know when both of you are ready.
Yeah. Okay.
Yeah.
Yeah.
Okay. Enter the station and do your task.
Hello, Joe Abraham. I'm Dr. Mamasi. I'm one of the mental health doctors. I understand you've been brought in by the police. Can you tell me what's been going on, please?
Who are you? Why should I tell you?
Okay. So I'm one of the doctors here, and I'm here to help and support you. And I would like to know more about what's going on so I can help you.
I don't think, doctor, anyone can help me because
Okay.
everyone, even in my family members are my enemy. Who else can help
Oh,
me?
right. It sounds really it doesn't sound really nice to feel that your family and no one can help you. Can you tell me more about what's going on?
Doctor, I don't, my brother, my brother and my stepfather. Do you think they are around me?
Right.
Because I can't
Uh,
speak to you if they are around me, doctor.
right. I
Can I
can't
talk to
see
you
your
can I talk to you in person? I mean, I don't want to talk in front of
right.
them.
Right, Joe. I can see you're quite agitated, and you're worried about people around you. Can I just reassure you that I'm here to help, and there is no one here, know what's going on. Oh, you talked about your brother and your stepfather. What's happening?
Yeah, I mean, they're they're trying to brainwash me, doctor. I know,
Mm,
like, they are trying to, take all my intelligence and transfer it to my brother's brain.
right. And for how long have you felt this way?
I mean, this is ongoing. This is ongoing, sister. I mean, doctor, since last 3 months, everything. Initially, it was there, but I wasn't able to understand. Nowadays, everything started making sense to me. Like,
Yeah,
and
right. So you said 3 months. Did anything happen 3 months ago or around that time?
no, doctor, I don't know. I don't remember anything specific.
Yeah. So how did this all begin 3 months ago?
I don't know. Like, I think, yeah, because one time I saw computer and they were planning something. And when
Mm,
I just passed from that place, they stopped talking about. I thought they were like, I know now that they were talking about me only. And I can
right,
also hear them. I can also hear them. They're also saying he's gone mad. He has gone mad.
right, right.
Yeah.
And why would they want to do this to you? Why would they want to take your intelligence?
Because I know, I mean, like, they know that I'm intelligent and my brother is a dumb, so they want to transfer all my intelligence. They are doing it via laptop, and that's why I went
Right,
to and I break through my brother's room. I wanted to take that laptop, and by that,
right.
I mean, by chance, I just injured my wrist.
I see. So it was while you wanted to take the laptop that you hurt yourself. And you said
Yes.
you've been hearing them as well. When you hear them, can you see them?
No, they are talking from
No.
corner of the room. So when I go and see them, they are not there, but I can clearly hear them.
Yeah. And you went into take the computer, you hurt yourself. Was there a fight? Was there some sort of altercation?
No, no, doctor. I went when they were not there. I
Okay,
planned. I will go the time when they are not around. So
right. So you've hurt yourself. Do you think, that might have been, you've caused some harm to yourself?
yeah, I already hurt myself. Like my wrist is, I have the
I see.
stitches have been taken in emergency. Yeah, I've already hurt.
Right. And all this going on, did you tell anybody?
No, doctor. I know no one will trust me because everyone is on their side only.
Okay. And I do you feel like, that they are trying to you know, control you in any way, control your thoughts or your movements?
I mean, no, they can't control me, but I know that they are up to something.
Right. And do you feel scared?
Sorry?
Do you feel scared of them?
Yeah, I feel scared many times because I think they can anytime they can attack me.
Right, right. And do you think you're going to hurt them?
I Doctor, I will try to defend myself and I have to do anything. I will do something. I mean, yes, I will do something.
Can you tell me more about what you would do to them?
I mean, I haven't planned anything, but I have to defend myself, right?
Right,
How
I
can I
see.
live like this?
Right. You've told me all what is going on. Do you think that maybe this might you haven't told anybody and the police have been involved, I have been involved. Do you think that maybe your family isn't trying to hurt you? Could there be an alternative reason why, you feel this way?
What alternative reasons, doctor? I told you everything.
I see. I see. It must be really hard. I see.
Yes, it is.
And have you felt this way before in the past?
No, no, doctor.
Have you had any mental health problems at all?
Doctor, are you trying to prove me that I'm mental patient?
No, not at all. I mean, I'm a mental health doctor, so it's only routine that I inquire about your mental health history.
1 minute.
No, doctor.
Okay. So do you think that this could be a mental health problem?
No, no, I'm not
Mm.
mental.
I see. And what about your mood? How has that been with everything going on?
My mood is okay. I don't have any problem with my mood.
Okay. And your sleep?
My sleep is also fine, doctor.
Mm. And are you able to take care of yourself? Like washing, keeping clean?
Yeah, everything I'm doing.
Yeah. Okay.
I don't have any issue.
Yeah. And with everything going on, have you ever like tried to cope with alcohol or drugs before?
I drink alcohol, but only socially.
Okay,
I don't take any drugs, doctor.
right. I mean, thank you for speaking to me, Joe. It's been really insightful. With everything you've told me, I think you have
Time
something
up.
called that.
Okay. So, okay, now let's go to your feedback. Okay. So this station is what? Mental state examination, right?
Yeah.
So you don't need to really ask about the history. See, be very
Okay.
careful. If they say assess, okay, and find out if it's primary or secondary delusion, assess the or do the risk assessment, something like that, then you can ask something about the past. But if it says do mental state examination is cross-sectional examination. Okay, it's in the present. Even if
Right.
the person had mental health problem before, how is that going to change your mental state examination in the present?
Yeah.
Okay, so don't waste your time on that. When you started the station, okay, you took the person's full name. That's not the way you should be addressing. Either you say Mr. with the surname, or you say the first name, or you ask how would you like to be addressed. Okay. Then she was looking around right in the beginning. Be very careful. In mental state examination, visual cue, if you miss the cue, it gives a very bad impression to the examiner. Most of the time, the actors will give you visual cues for a very short period before they stop doing that. So if you don't
Yeah.
pick it up, you get a zero for that. Okay. So if the person
Yeah.
is looking around, looks distracted, you must comment. Okay, it took a while for the actor to actually ask you that is it safe for me to talk. But if you would have picked that up before, I can see that you're looking around. May I ask what is it, that you are looking at, or what, I can see that you're looking, in a different direction. Can you tell me what can you see, or is there something bothering you? Anything. You just need to get that information out. Probably the actor would have told you there itself. I feel a bit worried that my brother and my stepfather are around, and then you can
Yeah.
provide reassurance. Also, it would give you a point that you pick the visual cue. Okay.
Mm-hmm.
Now, when the person is looking anxious, you don't use the term agitated. Okay. Agitation, aggression, these are all jargon which should be used medically. Okay. Like the person is agitated or person is aggressive. You can't say you look agitated. Okay. You look a bit anxious. That can be said. Okay.
Mm-hmm.
What's going on? Tell me more. Right. So don't use the word agitated. You checked the onset 3 months before, you checked the trigger. I would say your structure was bit here and there. Now remember,
Yeah.
when you're checking the delusion, what is the delusion? That the father, stepfather, and the brother, they are, stealing the person's intelligence and putting it into the laptop because the brother is supposedly very dumb, right? So any delusion, you should handle it one by one, like how, what, why. Okay, how are they doing it? What are they doing? Okay, how are they doing it? If they're stealing your intelligence, how I can help me understand how is your intelligence, being picked up and transferred in the laptop? Is there any agency which is helping the transfer? How is that being done? Okay, how do you know that it's being done? Because the person feels that he's forgetting things. Okay, how do you know that this they are doing it to you? Why are they doing it? How, what, why? Conviction. Okay. Now remember,
Mm-hmm.
conviction should not be confused with insight, right? If you are asking, could there be something else going on? So, long sentence, police has got involved, I have got involved. Do you think something is going on? Or something else is going on? Now, it's not clear whether you're checking the insight to the mental illness or you're checking the conviction. Okay. When you check the delusion, there itself conviction should be checked. No delusion is delusion till the time there is a conviction. Okay. Are you sure they are doing this to you? Could there be some other reason? Could there be some other explanation? Most of the people do this mistake. They confuse conviction with insight. They're very different things. The other thing is once you've checked the insight into the mental illness, that should be the last statement. You can't check mood after insight. Okay. Go, there should be a process. Okay, now this person has also hurt the wrist or injured the wrist by trying to jump into the brother's room. Okay, so deal that separately. Once you've done the psychopathology, then you can ask, okay, tell me how or the person said that that's why I had gone to get hold of the laptop. Okay, so immediately, you can ask the question, okay, so do you mean your brother's room? Who else was there? Was he there? You asked about the conflict, or was there any sort of altercation, but first check who else was there. Did you make sure that nobody else was around? What was going in your mind? By any chance, did you have any thoughts of harming yourself or harming your brother? What would have happened if he was there? Okay, so you've done a bit of risk assessment there itself, right? Now, the thing about the voices. So, if the person is saying that I can hear through the corner of the room, okay, get a bit of more information. Like, are the voices in your head? Can you hear them through your ears? How does it make you feel? Okay, because you need to make the examiner understand that you are actually dealing with hallucination and not pseudo hallucination. One hallucination means, or if you're doing a mental state, all the five dimensions should be checked. Any strange sensation on your skin? Okay, can you see anything which others can't see at the same time? How does the food taste these days? Any different smell in the food? So all five should be checked. Somatic passivity you checked, but you should also check FRS. So thought insertion, thought broadcast, thought withdrawal, because this is a mental state examination. Exactly like history, you have certain points. So in mental state also, you'll have certain points to cover. Okay. You can check, things have been very difficult. How has it impacted your mood? Are you eating enough? Are you drinking? Okay. Are you sleeping? Are you doing anything at all to keep yourself busy? Okay, so you're ruling out depression with psychosis. In the end, you should be checking inside. What do you think is going on? Could there be something wrong with the mental state, or however you want to check the inside? Okay, but don't. So what you did was you started talking about mental health problems before. You mixed your questions here and there. Very big question about insight, asking the same question again. So you missed. You asked extra questions at some other place, so you missed the important areas here. Remember,
Mm-hmm.
any mental state examination should cover all these points. Doesn't matter what the person's psychopathology is, because otherwise you'll not score on that domain.
Yeah,
Okay?
sure. Mm-hmm.
Unless obviously, some patients can be very, very difficult. So examiners are considerate. They think that okay, you didn't get time. They might overlook that because then your station goes towards half 50%. It goes in your communication style. Okay, but things
Mm-hmm.
like this, when the actor is giving you enough information, you should not be missing any of the domains. Okay.
Mm. Yeah, sure. Definitely.
Any
Thank
question?
you. No, it's really insightful what you've just said. Thank you.
Okay. Should we go to the next station then?